Good evening, everybody, and welcome to the New Teeth Now webinar. My name is Bianca, and I'm here with Dr. Richards tonight. And tonight we are going to be discussing dental implants and the New Teeth Now procedure. Thank you all for joining us. So, Dr. Richards, how are you? How's everything been going?
Doing well. Kind of, had a little time off, and looking forward to get back in the groove, so to speak. So we're all doing well.
Yeah, it's been different, and we're opening back up May 11th, so we're introducing new safety protocols. So we can kind of get started talking about that if you'd like, just to let everyone know what we've been up to with the planning.
Yeah, I'll talk about that some. We back around March 20th, Governor DeSantis recommended that elective procedures slow down, and so we started slowing down around March 20th, and then sometime about a week after that, he mandated that elective procedures in outpatient surgery centers, in hospitals, and dental offices cease. So we stopped, and so we've been doing emergency care in our office, and then taking care. We're here in Lakeland. We're a level 2 trauma center, and Dr. Kirkpatrick and I take care of facial and jaw fractures. So we've been doing all that regular stuff out there that's necessary. So the original executive order opened us up on the 8th, which is Friday, and so we elected to open on the 11th. And then after Governor DeSantis' presentation on Fox News a week or so ago, reviewing the state of everything here in Florida, he decided to open most of Florida starting Monday, the 4th. May the 4th be with you. And so today's Cinco de Mayo, we actually had a very soft opening, and Monday on May the 4th we did a briefing with our clinical staff in the morning, with our business staff in the afternoon, about new policies and procedures. We're doing a very soft opening Tuesday, Wednesday, Thursday, having a debriefing Friday, and we're going to start elective procedures on Monday, May the 11th. So we're kind of easing back into this a little bit slower than maybe some. It's going to be a little bit of a new world and a little bit of a new experience. Things are going to be at a slower pace. Here at New Teeth Now, about 80 to 90% of our business is what we're going to talk about tonight, full mouth reconstruction. And when we do a full mouth reconstruction with implants, I have one patient all morning. Dr. Kirkpatrick has one patient all morning. And so there isn't much traffic in and out of our office when we do the majority of what we do, which is this. And so that actually works out very well for everybody. But just to show you a few things, you've all heard about the famous N95 mask. This is the so-called N95 mask. Fits a little tighter, has a little bit better filtration, and we're using these to do routine exams and consults and things of that nature. We get into the hospital issued this to me, and even though I wear glasses, my close-up vision is very good, out to about 18 or 20 inches. So when I go to the hospital to do a procedure, this is pretty much it. So these, I don't know if you can hear me, but these cartridges are removable, and they are good for 40 hours. 40 hours of breathing, and then they just kind of quarter turn, snap off, and you throw them away. So it's not too bad. I mean, it's somewhat cumbersome, but actually the respirators, some of them are more comfortable than the N95 masks. And we do a lot of procedures with loops and headlights, And somewhat cumbersome with the loops and the headlights. Of course, the next level is this. And I've done a little bit of work with this. The visual clarity out of these is very clear, and actually my magnification loops will fit under these. So these are the full face respirators. So in terms of what we do, we work in the airway, as do ear, nose, and throat doctors. And so at the hospital, the oral and maxillofacial surgeons and the ear, nose, and throat doctors are considered the highest risks, followed closely by the anesthesiologists who deal in the airway, putting the breathing tubes in. So they made sure that we had adequate protection. So when my son went to the Watson Clinic the other day, he encountered a person at the table outside the door who asked him, "Have you been sick?" Took his temperature, asked him if he had been around anyone who had been sick. "Have you been around anyone that's been out of the country?" And then when he answered negative to all that, they gave him a mask and allowed him to come in the building. And that seems to be the routine, new normal for life right now.
Yeah.
And so that's what we're doing. We're basically doing what Lakeland Regional Medical Center does. All of our employees are wearing masks. We're taking temperatures with a cutoff of 99.9, asking questions. We are in a situation now where we're almost like a concierge oral surgeon. There is no more on the treadmill. People have appointments, and the doctors are waiting for the patients rather than the patients waiting for the doctors. If you have a 2 o'clock appointment, you will be seen at 2, but you better be here a little bit early to get all your paperwork taken care of. So it's going to be a little bit of a new world for a while. It's going to be a lot slower pace. We're taking all the necessary precautions to protect our clients and to protect ourselves. So that's, I guess, pretty good summary of
Yes.
what's going on as far as
The new protocols.
Yeah.
And dental offices are the most prepared to keep patients safe during any time. So it's great. I feel we're in good hands here with keeping everyone safe and healthy. But let's get started to learn a little bit about dental implants. So you're a board certified oral and maxillofacial surgeon since 1982. So you have over 40 years of dental implant experience. And you are the innovator of New Teeth Now. So can you describe in a few sentences what is New Teeth Now?
Well, New Teeth Now is a procedure where a person, of course, after the consult, the first visit, review of all the records, making a diagnosis, presenting a treatment plan, getting a medical clearance, doing everything pre-operatively that we need to do. A person would come into the office at 7, be greeted by the nurse anesthetist or anesthesiologist, and taken back to the OR. They'd be placed under general anesthesia. We do our thing. Depending on whether it's 1 jaw or 2 jaws, it may take anywhere from 2.5 to 4.5 hours. After the procedure, the anesthetist monitors the person while they're awakening. All of the records go to our in-house lab, and at about 3:30 or 4 o'clock in the afternoon, there is a set of teeth placed into the person's mouth and secured to the implants with screws. So the teeth go in, they're screwed down, and you cannot take them out. So that set of teeth is not the final set of teeth. I've been in this game a long time. I've been through teeth in a day, teeth in a week, teeth in 3 days. What we're doing now, where we put provisional teeth in to allow the person to test drive the teeth for a few months while they're healing, and then come back and have our own in-house restorative dentist, who you'll meet later in the webinar, to make the final teeth out of a more secure material called zirconia. That was more than a few sentences.
Hey, that's a good overview.
Basically, that's what we do.
And so here's what the upper hybrid looks like. There's the implants, and you can see in this, it's almost like an invisible see-through to the gums. So those are the implants. The teeth are attached to them. And this, how is this different than a denture? So you don't cover the roof of the mouth with this hybrid.
Right.
Well, we've got some examples here.
Perfect.
Pick these up.
This, I don't know if Ted can pick this up, but this is a denture, and it sits in the mouth and covers the palate, as Bianca was saying. And it is held in by wet mouth tissue, sort of developing a suction with the acrylic. This is a dental implant bridge, and so this is a horseshoe bridge that goes around the arch from the molar on one side to the molar on the other side, and all of these little titanium cylinders interface with the implants, and there's little holes through the teeth where the screws are inserted to secure the teeth to the implants, and then those little holes are filled with a filler material. So that's what that looks like.
So in the uppers, we have usually around 6 or more.
Usually 6, right. I mean, 6 is typically the minimum.
Okay.
However, if we see someone who has absolutely no bone whatsoever, and we're going to be doing 4 zygomatic implants, then 4 implants would be the number of implants that they would have.
And then here's the lower, so that's usually 4 or more.
4 to 6 on the lower.
4 to 6 on the lower.
Don't want to get the implants too close. Need to have healthy bone in between the implants. So sometimes it's 4, sometimes it's 6.
So that's a little bit about what it looks like. And he kind of went over this just a few minutes ago with the procedure. The patient's put under sleep with general anesthesia. It's pain-free. You go to sleep, you wake up, it's all done with. The teeth are extracted if needed. Dr. Richards places the implants up in the lab, or you're taking impressions for the lab after the surgery. And then the patient wakes up in the private recovery room, and the in-house lab is creating the teeth during that time. And then the teeth are placed in the patient's mouth and adjusted, and they leave that same day.
Right.
So you kind of already went over that, but that's how that single-day procedure works. And it's all in one office.
Right. And that's, one thing that we've sort of gravitated towards over years and years of being in this business, is that when you're doing the full mouth complicated procedures, having the person go to the surgeon and then having a separate office for the restorative doctor and a separate outside commercial dental laboratory, you have 3 circles, but none of them are connected. And so what we have done with our business model is that under one roof we have the surgeon, the dental lab, and the restorative doctor. So everything is done, as that slide says, all in one day and all in one office. And I can just tell you, after being in this business for a long time, that this is sort of the cat's meow, so to speak, in terms of doing complicated work with communication between the surgeon, the restorative dentist, the commercial dental laboratory, in terms of convenience to the patient who doesn't have to get in their car and go to a different place and back and forth. And so it's a great business model. It works. What we do is repeatable. We've been doing it for a long time, and that's why we're so busy doing this.
Yeah, it has great benefits. And we had a couple questions, so let's talk about those really quick. So the first one is, will the first set of teeth fit flush to the gums?
The first set of teeth will fit flush to the gums. And when the impressions are taken while the person is under general anesthesia, it picks up not only the position of the implants, but it picks up the soft tissue. So when the teeth are fabricated by the lab, when they're made by the lab, they are fitting flush with the gum. But then, over 4 or 5 months of healing, things will shrink.
Right.
And the teeth then are not as flush with the gum. Hence, one of the reasons that we do a temporary set of teeth first. Because then Dr. Dibbs comes along. Dr. Dibbs is our restorative dentist, and you'll see a clip of him later in the webinar. He comes along with new impressions or 3D scans that picks up the soft tissue as it is then, and when the teeth are made in a virtual environment, then they're molded to the soft tissue so that there is sort of a potential space, not an open space, but because the soft tissue is compressible, there has to be some space so you can get in there and clean it. But yes, the teeth are adapted to the tissue.
Yes, and that's one of our benefits, because a lot of other places, when you leave with final teeth, then the next day you're going to get that gap, and you're not going to have teeth once your gums have healed. You're going to always have that gap. So that's a big benefit of why you wear the temporary set of teeth until everything's healed and get your final set of teeth.
Not to mention the fact that a lot of people want to change the size, the shape, the color of the teeth. Sometimes they want to show more tooth when they smile. There are just lots of things about test driving that first set of teeth that are advantageous, rather than getting the final teeth the next day and then getting on an airplane and flying 4 hours back home. If you have a problem, then you're in trouble.
Mm-hmm.
So, having that first set of teeth being temporary is, in our opinion, it's a huge benefit.
And then we had another question: can the upper and lowers be done at different times?
That's easy, yes. They can. The only qualifier is, let's say a person comes in and they want to have their upper only.
Mm-hmm.
And their lower teeth are crooked and not level. You don't want to make a final upper against a lower set of teeth that are not level and are crooked. Because then when you come along to do the lower, then you got to redo the upper teeth, because
It won't match up.
you've got to have everything matching, or you'd end up making the lower teeth crooked on the new implants. The lower teeth would have to be crooked to match the upper teeth, which were built to the crooked lower teeth.
Right.
So, but if a person came in with an upper denture and they had lower teeth, and the lower teeth were straight and level, then they could have the upper implant procedure against their lower teeth, which were in good position.
Mm-hmm.
And then later could come along and have the lower teeth out and have the lower implant procedure, and the bite would be okay.
Yeah.
So it depends on the health and the position of the teeth in the opposing arch.
You talk about that in a consultation. So we'll just show you an image of our actual office so you can see what it looks like. So that is our office. It's pretty big, but that's because we have a lot of people working, and a lot of things going on.
We do have a lot of things going on.
Perfect.
So the original office is this up front behind these palm trees, and that worked well for us from 2002 to about 2013. And then we had this empty lot here that we built on. Upstairs, right through these windows, is the lab. Right below it are 2 operating rooms that are very large and equipped just like a hospital or an outpatient surgery center. And then Dr. Kirkpatrick's minor treatment rooms are there, as are Dr. Dibbs, who you'll meet later in the webinar. His treatment rooms are up there as well. So all told, it's a fairly significant facility.
Yes. So we are going to learn a little bit about Karen. So she's from Pennsylvania, so she flew in out of state for the procedure. She had her upper denture. She wore it for about 15 years, had a lot of different tooth problems, and also had extreme dental anxiety because of all of that. So we're going to hear a little bit about her.
To go through life not worrying about your teeth is going to be so amazing. I'm a YouTube creator.
Within 2 days, and I got $200 for them. Yep, $200 for an item I have no clue about.
Before I had my dental implants, I deleted a lot of the videos that I made for YouTube because I would make a video and it's a little surprising to see what your teeth really look like. It's almost worse than what you think. When I first started looking into dental implants, like I said, I researched a lot. I actually looked at going out of the country because of the cost. And I didn't feel confident in that because I knew I'd be traveling on my own. So coming to Florida from Pennsylvania, I knew I would have to stay in a hotel, and I wasn't quite sure how much of a challenge staying in a hotel room by myself would be. But when I called New Teeth Now, I spoke with Shauna and Nicole, and let me tell you, I've never met, and this is the truth, such gracious, helpful people. They helped me find my hotel room. I mean, even during my trip there, they made sure I got on the plane safe. They called me when I landed. They brought me to the grocery store because they knew I didn't have a rental car. I didn't rent a car because I knew I'd be on medicine. You know, I figured I can't be driving. They brought me to the pharmacy to pick up my prescriptions. So the travel was great. Pennsylvania to Florida is only a 2-hour trip, so that was great. And I had a hired driver to go from the airport to the facility. So in the morning when I arrived, I really didn't have too many thoughts because I felt confident in the surgery team. I had met everybody. I was joking around with the anesthesiologist, like, just let me have a good nap. I wasn't anxious about it. You know, I felt like the whole team has my best interest at heart. As I woke up, I was shocked that I didn't feel anything. I really expected to be in pain. I didn't even need to take the stronger pain medication. The professional level, the caring, just the attention to detail at New Teeth Now, I've never experienced that. You know, I felt like the whole team has my best interest at heart. When I met somebody new before I had the implants, I felt like I could see the point, at what point in the conversation they would be looking at my mouth to try to figure out what was going on with my teeth. And now I feel just more relaxed, and I think it's more engaging because I smile bigger. You know, I think I put the other person more at ease because it's not awkward. You know, I just feel like I can be myself. So that's been huge. I was in with one of my regular buyers. They said, wow, you look young. Your hair looks great. What happened to you? And they didn't even know it was my teeth. And I was like, oh, thanks. That was amazing. I knew it was my smile. I feel like just being able to relax in life and enjoy life, and when you're complimented, it strikes you as like, wow, I'm not worrying about this anymore. Definitely life-changing, yeah.
And she looks so fantastic. She is so confident, and now she can host her YouTube channel and just smile and not have to be self-conscious of her teeth, so it's really awesome. And she was also able to kind of get over that dental anxiety because she was in such good hands here and felt so safe. That actually kind of fixed that, so that was awesome. But yeah, she just looks great, right, Dr.
Oh, yeah,
Richards?
Karen's a very nice gal.
Yeah.
Had a lot of nerve getting on an airplane by herself, coming down here with total strangers.
Yep.
That's one thing that always amazes me is the trust that people put in us. And I think I talked about this at the last webinar. It's really quite humbling, the amount of trust that a person who would come down here and meet me or meet Dr. Kirkpatrick one time and put that much trust in us, and then you know, when it all turns out nice, you know, it's very satisfying for everybody. You know, it's crazy.
That's good, really good. So we'll go into kind of the, you know, the traditional implants and then go into zygomatic implants. What is kind of the healing time following the new teeth now procedure?
For something like what's on the screen, a traditional procedure, that person would heal for 4 to 5 months in their first set of teeth, and then they would be turned over to Dr. Dibbs to make the final teeth. And the fabrication of the final teeth could be done in 2 appointments, or it may take 4 appointments. Now sometimes when we do the first set of teeth, we just nail it. I mean, the person just is so happy with the way the teeth sit in their face. Their smile looks good, their bite looks good, their lip support looks good, the vertical looks good. I mean, they're happy with everything, and they say, listen, just duplicate these. Don't reinvent the wheel. And when Dr. Dibbs hears that, then it's about 2 appointments to get the final teeth made. If the person says, I want this changed, and I want this changed, and I want that changed, and there's several things, then typically Dr. Dibbs will make a new set of temporary teeth incorporating the changes and have the person wear those to make sure that the changes are the way that the person wants them. And once the person is happy in that second set of teeth, then Dr. Dibbs will make the final teeth. And that takes maybe another appointment or 2.
Okay.
So a lot of folks that come from out of town, they'll come in and see Dibbs on Monday, and they'll get their final teeth on Thursday. And so we make some special arrangements for our out-of-town clients who want to do that. So.
Awesome. And then this is showing our zygomatic implants. So what's a zygomatic implant? Who needs those?
Zygomatic implants have been around for a long time. We got into the zygomatic business early in the curve, back in 06, 07. Zygomatic implants are for use in the upper jaw only. They're for people that have no bone in the rear part of the upper jaw, or have no bone in the rear part of the upper jaw or the front part of the upper jaw. So if someone has no bone, front or back, they would get 4 zygomatic implants. If someone has good bone for traditional implants in the front part of the upper jaw, they would get 4 traditional implants in the front part of the upper jaw, and then 2 zygomatic implants in the rear part of the upper jaw. We use zygomatic implants in 85% of our upper jaw procedures because of the position of the sinus and the fact that there's no bone in the posterior, in the rear part of the upper jaw. We have sort of become known as the Zygomatic Center, and people come from all over the place to have us place zygomatic implants. So zygomatic implants are the graftless solution for people that do not want to have a graft, who do not want to, let's say, go in the hospital and have hip bone taken, who do not want to wait for months and months and months. That's who would be a good zygomatic implant candidate.
That's a great solution. And do they feel different than regular implants, or?
No, they don't. Well, no, they don't feel different than regular implants. They are regular implants. They're made out of the same material. They're the same diameter. They're just longer because they're going to plug into the cheekbone, which is the zygoma bone. If you go to the computer and you search the zygoma bone, what you're going to find out is the cheekbone that forms part of the eye socket. And so these implants go where there is bone. When there is no bone down at the jaw bone, they go to the zygoma bone, and they have to be long enough to reach out there to become stable by that bone.
And so that's a little bit about the zygomas. So this is your team. These are the ladies that work with you in surgery and seeing patients. They're a great group.
Right.
And then this is the anesthesia team. They have over 25 and 30 years of experience, and they work with you guys every day too in surgery.
Right.
And then this is Dr. Dibbs, who Dr. Richards has been mentioning. He is one of the restorative doctors here. And so we're gonna watch a video of him and how he is able to work with the dental lab and making things even easier for the patients.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Yeah, so it's amazing what the lab can do and how easy it is. So they're both upstairs, the restorative side and the lab, and they can just walk across the hall, see patients, and it just makes it so much more efficient and easy when the two can communicate really well. So that's great. And here is our dental lab team. So here are the master artisans. I always just really liked this image because, so on the bottom, that is a set of teeth that are made out of acrylic, and on top is the set of teeth that are zirconia. And these teeth have been worn for 5 years, so you can see the strength and why we use zirconia teeth. They're the strongest material. They don't yellow. They don't break down. They're super durable. They're even stronger than even natural teeth. So it's a great comparison to see why we use zirconia.
When you look at these bridges, these prostheses, they're not like individual teeth. And you can see on this example, there's several millimeters of gum-looking stuff. And so a lot of the people who have these procedures have been in dentures for a while and have had bone loss. And so you have to have simulated artificial gum tissue to fill in between where the teeth are and where their actual tissue is. Some of these prosthetics will be thicker and show even more pink. Some of these prostheses on people that have not had as much bone loss will be thinner and will not show as much of that pink tissue. And this is a solid one-piece bridge that goes all the way around the arch from the molar on one side to the molar on the other.
Yeah, that's a good explanation. And these are our implant coordinators. So this is who you would see when you came in for a consultation along with Dr. Richards. And they talk you through the whole process. They help out-of-state patients with all their travel accommodations. They're really just here with you the entire time to make sure that it goes as smooth as possible. And this is our CT scan. That's also what you would take at a consultation. And how long does it take to get this scan? Just about a few seconds, right?
Yeah, not
Yeah.
long. 30 seconds in there. There's no claustrophobia. It's not like you're closed in anything. So, folks that are claustrophobic, you don't have to worry about that.
And what does this show that a common X-ray wouldn't?
Well, a common X-ray would be like a photograph of your backyard. It's flat, a flat picture of a three-dimensional object. Whereas with a CAT scan, we can look at things in different planes. We can look up and down the long axis of the person. We can look sagittally, sideways, or we can look what we call coronally, front to back. So we can accurately measure the width of the bones. We can measure where the sinus is or isn't, and get a very good idea of where we are able to and where we are not able to place traditional implants, where we might have to go to zygomatic implants.
Awesome. Yeah. So that's where you would finalize your treatment plan through the use of that CAT scan. And then we're gonna go into some patient before and afters. So this is Bruce. He had a lot of pain. He couldn't eat the foods, lots of foods, especially the ones that he loved. But after the procedure, now he can eat anything. So he looks great and just enjoying life. And then here's London.
It was 5th grade when I first went to the dentist. Then that dentist discovered that I was missing a bunch of adult teeth behind my babies. So once my babies came out, there was no adult teeth.
Oh, I actually left that appointment and dropped him off at home and went to a girlfriend's and cried for hours.
We were in middle school, and it was my English class. And then this girl who I had a crush on at the time just saw me and she was like, open your mouth. She's like, you don't have any bottom teeth. Every kid in class at that point started staring. Basically, that led to multiple events of people just making fun of me and stuff like that. Yeah, there was a lot of those moments.
And luckily, we were able to get the Snap-on Smile at least so that he could get through high school. I am grateful for that. I know he still had many issues.
I mean, if you know what I'm working with the Snap-on Smile, you'd be like, how can he eat with these? Because they're flat, there's no edge, they're weak. My teeth came out in an apple one time, they got stuck in the apple. Anything temporary like that, it's just not possible to be, confident and to be happy because you're constantly worrying about that. So I actually learned from my mom. She had told me that there was this place that they could do teeth in the same day. I didn't really believe that because everywhere else I went to, 2-year process to do bone grafting and whatnot, so I was just like, yeah, right.
And I have seen so many dentists throughout his time, and they all are like mortified by that X-ray and the 3D scan. They're mortified. They just don't even know what to do. Dr. Richards did not do that. He looked at it and went, okay. He had no doubt. He knew he could do it.
From my perspective, he'll get traditional implants in the front, and he'll get some zygomatic implants in the back. We did one just about like this yesterday. He'll have a set of fixed teeth this afternoon without any bone grafting. He will not have to take those teeth in and out. It's going to be wonderful for him.
Oh my gosh. Oh, this is crazy. Oh, I don't even feel like I'm looking at me. Oh my gosh. Oh, this is so insane. Oh wow. I don't even know what to say. I just feel like there's a different person in the mirror. The biggest part about these is not being able to take them out, not having something that can come out. Because there's so many times in my life where, they've almost fallen out, and it means,
I mean, that's all gone.
so I don't have to worry about that anymore.
Yeah.
I don't have to hide anything.
So that he could live fully, feel good about himself, with confidence.
It's exciting to have that confidence and just completely change my life starting today.
So we are just so happy for him. It's an amazing transformation that he waited his whole life for. So it was just wonderful. And we love those stories. And we can, I mean, a case like that is rare, but we can do even the most complicated of cases. So there's really nothing too complex. So even if you have a case that other people have turned down, you should call us because we can probably do it. So we'll go into a couple more before and after. So this is Crystal. She had painful, loose teeth. She was tired of covering her mouth, but after the procedure, now she's laughing, she's smiling, she's talking to new people. It's just a whole different lifestyle when you're fully confident. And then this is Gladys, and she had difficulty chewing, and she had infection and embarrassment. But now she looks so much younger. And she actually specifically chose us. She loved that we placed patients under general anesthesia. That was like her thing that she wanted. So that was great. And that's a great benefit of having the New Teeth Now procedure. And if you are interested, definitely now's the time to give us a call and set up a consultation. We're here for you right now. Our number is 1-800-615-5838. We are so glad that you have sat with us for the last hour. If you have been listening, you've definitely been listening for a reason, and the New Teeth Now procedure is probably something that you need. But you are in such good hands with Dr. Richards, as you could see in the testimonials. Like, he will take care of you and be able to restore your total health and happiness. So we are here for you. We want to hear from you, asking us questions, more about the procedure, and then setting up either a free phone consultation or that in-person consultation where you can get the treatment plan. But we thank you all for joining us tonight. Thanks, Dr. Richards, for being here with us, and we hope that everyone stays safe and healthy and has a wonderful evening.
Thanks for joining us.